Thank you so much for joining us for Frontier Night. This is an inspiring night when we get the exclusive behind-the-scenes look at the science fueling new discoveries and hope in our fight against cancer. And it's all possible thanks to your generous giving at our annual Illumination Gala featuring the Cancer Frontier Fund.
What we really are is the ripple effect of hope that comes through caring physicians, incredible scientists, and donors who believe in innovative research that makes a difference in people's lives. That hope, that ripple effect, is part of my life for over 20 years, having been diagnosed with breast cancer about 20 years ago as a very young woman, 3 months after my mother was diagnosed with breast cancer. We went on that journey together.
What our investigators and our physicians are doing in terms of prevention and treatments and cures and hope is just amazing. In fact, it was unimaginable for me what we see today.
We couldn't do what we do if we didn't have these carefully invested dollars in new ideas. We've invested 120 projects and we get an 8.5-fold return on investment. That's all because of you.
The wonderful Pat and Mark Burkhart made a generous Pat Burkhart Breast Cancer Research Fund. I got to be a recipient of these funds. This is a single resistant cancer cell in bone that we've been trying to figure out why are these things resistant to treatment. And we figured out what they're making, how to target them. We treated them and it worked.
You all are instrumental, critical to any of this happening. I thank you deeply, and I know my patients do as well. We trained an AI program to look at those heat maps, and the diffusion histology imaging, DHI, which is this AI program, takes all those images and it spits out to us and says, you know, there's a tumor here in purple, and not only is there a tumor there, we can tell you that we think it's probably a high-grade tumor.
This is what the future of prostate cancer at Siteman is looking like. We've got our DBSI molecular MRI that now gives us a non-invasive risk assessment. And finally, these are the 3 words I want to leave you with tonight. Can we actually start to develop something called a virtual molecular prostatectomy that does not need scalpels or needles, give us a risk assessment that we're going to now use to develop a treatment earlier on for the patient that's going to save his life. The data I just showed you has been now recommended within funding range at the NIH for another $3 to $4 million.
What we're currently doing with the SIP funds that you all contributed to was to try to identify barriers and facilitators that impact the recommendations for physicians. We have a breast navigator in the clinics with the surgeons. She does a preliminary assessment on who should get tested, and we're doing this to see if we can close the gaps and improve genetic testing for Blacks with breast cancer.
There's really only a handful of centers like Siteman that can do the type of integrated research you saw tonight, and that is really pushing the frontier of cancer research, treatment, and diagnostics, and is now being recognized for that disparities work, which is so important for our community.
All of this innovation changes lives and makes families and people whole, not to have to go through the devastation of cancer. I can look at cancer at the human level, know what it's done to the life of my family, myself, my friends, my partners, my colleagues, my community, and know that I want something different. So I'm going to do what I can do and work with our ambassadors and all of you to say, give.